everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you another in our series of interviews with healthcare leaders. And today is a special guest, someone that I met at the health conference in Boston. And to be honest, it was the highlight of my event. So I knew she had to come on and share some of her story. She's Effie Parks. She's founder and host at the Once Upon a Gene podcast. Welcome, Effie.
Oh my gosh, John. Hi. So fun to be here. I'm so excited about this conversation with you. And it was definitely a highlight of mine to meet you there as well.
Yeah, I mean, we had so much fun learning. I did, at least, learning about you and sharing a few tears.
Oh my gosh,
we
had the best
made
time.
You cry there at the party.
Anyone who listens to my podcast can believe that you made me cry. Yes.
That's fair. That's fair. So for those that don't know you, tell us a little bit about yourself and your story.
Sure. I live in Seattle, Washington with my husband and my two kiddos. 5 years ago, I gave birth to my first child, Ford, my son, and he was born with a rare genetic disease called CTNNB1 syndrome. When he was born, he was 1 in 30 patients worldwide that we knew about. And we were kind of just sent off with that information and to see you later, love your kid, and have a nice life. It was a really, really crazy introduction to motherhood. It was really traumatizing. It was definitely nothing I expected. Everything was new with all of the health issues that we were dealing with just right away with our son. And it was a pretty rocky beginning to discovering the world of healthcare in general and just everything that ensued after that. It was not a lot of guidance in any direction, really. So
I want to dive into that, but let's talk about even just the name of the disease. How almost brutal is it that the disease is CCT, and I don't remember the letters and numbers you just said. It's this disease is not even worth a name. That's what that says to me, which is kind of an illustrative of the challenge of a rare disease, right?
Definitely, especially when you're trying to raise money or tell people about it and gain some connection. A lot of these diseases, they're getting discovered right pretty recently. I mean, science is moving at such a quick pace. CTNNB1 was discovered in 2012. They don't have papers written or studies done, so there isn't a fancy doctor name to kind of attach to the disease, because once they're being discovered, as the genome's being mapped and whatnot, it's just like check, 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 and you're just left in this vast area to just kind of be orphaned, right? They call them orphan diseases for a reason. And unless you get someone to jump on board, make your advocacy group, study your gene, you're not really ever going to have a fancy name to attach to it. That takes a lot of work, and it takes most of the work from the parents creating these groups and starting to move things forward for their gene.
Yeah. So let's talk about, you described that, you were informed, okay, this is the disease he has and here's its name. And then they basically said they can't do anything for you. Is that kind of the experience?
Yeah, that's exactly the experience. Our geneticist told us that there were 2 papers that she saw that were short-lived. And what she learned was that my son, with the other 30 patients that they knew about, that he might be able to say a couple words and he might be able to take a couple steps. There was no information on really anything else about health issues that might come up, or, different diagnoses and symptoms that are involved with this. There wasn't, here's a global genes, here's a NORD, here's a community. It was just what you should do is go get therapy, something called early intervention. Anyone listening who's had this sort of introduction to parenthood will know what that is. It's where
that was therapy for you.
That's therapy for your kids. So if you have a child who is missing milestones or who has developmental delays, there's something called early intervention programs in every state. It just has a different name typically. And that's where you'll get physical therapy, occupational therapy, speech therapy type things. That was what we were told to do. And that's all we could do, because this rare disease has no treatment, no cure, no nothing. And there's really nothing we can do about it. We don't know anything about it. And yeah, I would say that that is the same old story for so many families who get diagnosed with these rare diseases. The doctors and clinicians who are delivering this news, mostly poorly, unfortunately, don't necessarily know where to direct you because most likely there isn't anything to direct you to. So it's a bummer.
What advice would you have for doctors or other, medical, organizations? How should they deliver the news? What would have been a better solution than just like, well, I can't do anything. Go over there. I mean, they're kind of passing the buck in some ways, it sounds like.
I think that this conversation has been brought up a lot, just even in the last couple of years, and the communication and the idea of continuity of care and collaboration between patients, caregivers, and doctors is really starting to meld, which is exciting. But even just 5 years ago, yeah, I feel like, especially depending on where you were, maybe what type of like institution you're at, there's a disconnect. And I don't know if it's timing on doctors' appointment schedules. I don't know if it's too rare to care is something that we kind of say a lot. Like, what is she going to do with it? Well, she can't start from ground zero. She's probably studying something already that actually has funding. But my advice is just pure human connection. Sit down with this family, understand what's happening in their life and how it's going to affect every single person in the immediate circle and then beyond for their family. A rare disease diagnosis is ginormous, especially when there really aren't any resources to turn you to. I feel like if there was just true, genuine, slowed down empathy in moments like that, when a family's getting a diagnosis, it can really change the trajectory of like how fast you decide to find hope or do something, or even just healing in general. I feel like being seen and being feeling like you can trust your clinician, that they actually care about the well-being of your family and your child, that is so small. And I think that that is something that needs to be practiced more so and make it less clinical and more human.
Mm. Yeah, I mean, the cynical John, which sometimes comes out and they says, well, there's no CPT code for that, right? there's no payment code for spending an hour with that family rather than the 15 minutes that you tried to crunch them in to give them that diagnosis and have that empathy. And it's certainly not trained in medical school, and I think quite the opposite's trained in medical school, unfortunately. So I think that's eye-opening to consider, just that slowing down and having a moment of empathy. Did you even go back to your doctor? I mean, was it something that you had to take your son back to the doctor regularly for visits, or did they just say, well, I can't do anything, so not even see you later?
Well, so in the beginning, we were taking our son right after birth to the pediatrician once a week because we couldn't get him to eat. We couldn't get him to swallow. So we were there every week, and we were being told by our pediatrician that we were just worried first-time parents and that everything was fine. And I must be breastfeeding him wrong, or we're feeding him wrong, or we're probably blowing it out of proportion. So for the first 3 months, we were completely dismissed, up until the point where she actually was worried because he wasn't growing. And she immediately admitted our son into Children's Hospital. So that was kind of the beginning that kind of propelled everything. So at 3 months old, as he was admitted into the Children's Hospital for about a week, that's when every specialist was coming in and doing their rounds. And that's when we got even referred to a geneticist. The geneticist was intrigued and decided to run a whole exome sequencing test that took several months to get. But in the meantime, Ford was seeing all of those therapists, and he was going to the neurologist and he was going to the pulmonologist. He was really sick for the first several years of his life. So we were at the doctor's a couple times a week, every week for the first few years, really. He was 16 months old when he did get that diagnosis, when the genetic testing came back. So we were at the doctor's every day until then.
Wow. Interesting. So you started the Once Upon a Gene podcast. Tell us, like, how did you decide to do that? Why did you decide to do that? It sounds like you were quite busy. Like, it's amazing to think this busy mother that's had her life changed with a son that wasn't how she pictured it, right? Decides to start a podcast. What went into that?
Oh my gosh. Well, like I said, there's just like you're thrust into this world that you have to figure out all by yourself. And you're scared and you're stressed. And all of a sudden, everyone starts to be a little further away from you. You're so disconnected from their reality and your reality and what their kids are doing and what your kid is doing. And it becomes you get to this point where you are so completely isolated and nobody around you understands what your life is like, what your day to day is like, what your moment to moment is like, that you're completely alone. And I like to describe it as like there was a big deep hole, and once you get this diagnosis or you're on this path, like you just get pushed in it and you're in there all by yourself, and you have to figure it out. You have to figure out a way to get out, and you have to figure out a way to find the people who are going to help pull you out. Mm. I couldn't find the resources that I needed. And it's weird because 5 years ago seems like a blink, but podcasts hadn't yet caught up. Lots of stuff just hadn't caught up in terms of community and parents who were like me. So when I was driving to the doctors every single day and sitting in the car for hours doing everything for my son, I started searching for things that I could listen to. So I was Googling everything I could think of: disability, disease, all of those things. And I came across 5 different podcasts that existed at the time, one of which really changed everything for me. They changed my perspective. They gave me hope. It was kind of like the first time I felt like I wasn't alone, and there was light, and there was other people like me, and I just knew I had to be a part of the conversation and contribute and find my people, because being alone and being isolated is just so opposite of just who I am deep down. But also it wasn't making anyone in our family thrive, and it wasn't getting us anywhere. And I just knew I had to do something about it. And I needed to learn like the science and what to do in an IEP and all of the things that we have to teach ourselves from other people who were living the same life as I was. So I decided, I think I'll just start a podcast. I have no idea. I just knew it was something I had to do. It's weird to explain it like that, airy fairy style, but I just knew it. And it caught fire almost immediately, John. I mean, there was such a need for it. There were so many parents all in their own holes and not necessarily being able to connect with people in a passive way too. That's another thing I really like about podcasting, is that I am so busy and I'm terrified and I'm this and I'm grieving and I'm driving, but I can listen to this story on this person's podcast when I need it and for how long I can. And I can go to it whenever I want. I don't have to be responsible to anyone. I don't have to set anything else on my schedule. I just love the connections that you can make at your own pace, especially when you're so busy and so consumed. And I think that is what's so special about this medium.
Yeah. Well, your comments about how you felt took me back to when one of my kids was born. I remember walking to the store after they were born, and I remember thinking to myself, my life just changed, right? Like dramatically changed. And everyone around me is just acting like it's normal. Right. I don't know if that
yeah, totally.
So your description of like, I'm in a hole and you're like, everyone around you is just acting like nothing happened. And it felt weird. Right. And in my case, I had a healthy baby, with no major issues. And so I had people to even talk to and, that understood that change. Whereas, in your case, you felt the same way as me times 10 probably. And then you had no one to turn to. So it's so powerful that you're doing that for people. I imagine you've met do you have some stories of people that you've met through the podcast that just helped change your life?
I could probably never list the amount of people who have just dug deep into my soul, and changed everything. And it's like every time I get off a call with someone, I am like reinvigorated and I'm like, how did someone do that again? There are so many powerful stories in this community, and there's so many gifts that these people have, whether they're a patient or a clinician or a caregiver. It's so moving to learn from all of them in their different ways. I have so many favorites, I can't even pick one. Um, I'm just gonna say, I'm gonna go with the most recent conversation that I had.
Okay.
My friend Luke Rosen, he's a dad to a little girl who has something called KIF1A, and he's one of those crusaders who started the Advocacy Foundation to fund research to find a cure for his daughter's neurodegenerative disease. It's horrifying. And he has worked his tail off since 2016, and he is so close. He is so close. And all of a sudden, he gets colon cancer, like stage 4 colon cancer. And he's terrified. We all are as caregivers, as parents. We can't die. We can't die before our kids. Like,
Yeah.
what's going to happen? What's going to happen to the research? Who's going to take care of our kid and care about them the way we care about them? Like, it's just not an option. We're going to live forever, which is irrational, but true. And Luke was talking about how, one, the research that he was fighting for to get a treatment for his daughter and all the other kids like her, what was going to happen to that, and who was going to take over and make sure that everything they had fought for was still going to move forward. And while this kept him alive in a time where he had just lost so much steam, it also gave him peace, because he realized he helped build something, and there are so many motivated people involved, and he did all of the work. He put up all the scaffolding, and everything is in place to make sure that this continues. And it was just a moment for him where he got to kind of validate himself, but also realize that we have to put our trust in other people, because guess what? We're not going to live forever to take care of our kids. And what was so beautiful was the amount of messages and just love that surrounded him after this episode came out. I probably got more messages about him than almost anyone, and how just embraced he felt, and how that trust jar of his was just overflowing. And he was talking about a really hard subject, and he was being really vulnerable about it. And I just think it's so important when we can share these stories, especially about that scary stuff that we all think about that we don't talk about, the elephant in the room. And it was really courageous, and it was really profound. And I'm so grateful to people like Luke who share this kind of stuff, because I mean, this ecosystem works with all of us collaborating and talking and sharing our stories and seeing each other in each other's stories.
Mm-hmm. Yeah, I mean, it seems like the message that I'm hearing over and over is just the value of connection, and the value of a community of people. I mean, certainly his story is probably slightly different than yours, but you can see some similarities, and at least, ironically, I've seen it in other communities. Like I've seen it in addict communities as well, that just seeing another addict that can recover gives you power and strength. Is that kind of what you felt from all these conversations?
100%. And yeah, it isn't something that's just for the rare disease community, right? Like, it crosses no boundaries. Connection. It's why we're here. And there's just something so powerful and so comforting in it, especially when you're in uncharted territory, and being able to have someone put out a lifeline for you in whatever way that is. It's transformational.
Yeah. Well, one of my favorite parts is when you do the Effisodes, I think is what they're called, right? Where you
Yes, the
share,
episode.
yeah, an episode is perfect. But where you share like some insight of what is it like to be you, right? What is your life like? And I know you recently posted some amazing videos. People should go check out your Twitter account too. You need to mention that, but of just your son smiling and laughing, right? And it's just beautiful to see that. But also, I think it's also hard for us to see the challenges but also the joy, right? That's a hard balance, right, in your type of position.
Yeah, absolutely. One of my friends coined it the other day, and I love it, and I've stolen it. Is how the grief and the joy mingle, and
Mm,
I think that's such a good way to describe kind of our day to day, because it can go from those moments, and they can just be right there together, and they can both be so big in the room. And I think acknowledging that both of those things are such a part of our journey is really important for our well-being. But it also is something that just slows everything down to
mm,
the moment, right? And how important it is to savor it and to be in it and to recognize the hard stuff and to appreciate the good stuff, and turning these milestones into inch stones for our world and celebrating them as much as possible, because there's a lot of heavy stuff. There's a lot of gallows humor. There's a lot of workarounds to get through your day to day and still feel like a regular person.
mm.
you know so I think really maximizing the joy that you have is so valuable, and it's like times 1000.
Yeah, I think it's hard for someone to see you and think, wow, she's just a joyous person, right? Like, I mean, that's what I see. Like, and it's amazing that you have that perspective with so many of the challenges you face. So kudos to you, and sharing that with other people. I think is a powerful thing, right? Because as they face it, I imagine many patients, parents of patients with rare disease, even that they see it and say, "Is there any hope for the future?" And I think that's what I've taken from even just these few minutes together. There's another topic that we talked about a little bit when we were in Boston, and that's really kind of the experience of the rare disease community and kind of being ignored. I mean, I'm a startup guy by nature, right? I read venture capital blogs as a hobby, which is super odd to say, but true. And when you think about it, and when you look at a startup, if they pitched, a startup company, a digital health company in this case, right, to say, hey, we're going to go after a really rare population, i.e., small market. That's how they translate it, right? You're like, we're not going to do that, right? Every VC would be like, sorry, no funding, your market's too small, all of this, right? So our economic system wants large markets with big opportunities. And so, my startup mindset is like, well, yeah, I mean, it makes sense from that perspective why the rare disease community was ignored by many of the dollars and investments. But I think you have a different view on this, right?
Man, there's so much to talk about in this world. But the narrative needs to be changed, period. I mean, there's even a little movement on like, should we not call it rare disease anymore? Because it's not necessarily that rare when you think about 1 in 10 people have a rare disease. Your
Mhm.
neighbor has a rare disease. Someone in the room where you are is affected in some way by rare disease. And that this is a public health issue, and they're going to continue to happen. They're not stopping. And the conversation just needs to really be redirected, especially with COVID, right? Like, you should put in your notes later if you can find it, but the Timothy Foundation made this really amazing, like, animated video after COVID. And it was explaining how collectively the world decided that COVID was important, obviously, and they rushed to make a treatment for it faster than anything had ever been done. And little Timothy syndrome over here had still never been looked at, had still never been considered because it wasn't enough people. And when you think about it as you're not enough as a human being unless there's enough of you, that's really, really disheartening as a human being, to feel so invisible.
Mm-hmm.
So I think just really looking at the numbers and looking at the fact that it is in your best interest to fund rare disease and to research rare disease because it's not going away. And yeah, I mean, there's so much there, John. I don't know if I answered your question.
Well, and it feels like the genomics is probably addressing this as much as anything I've seen, because the genome, I mean, it's so complicated, but the discoveries that could happen across, 1,000 rare diseases, which then makes it a big market segment. So I imagine the genomics community is probably one of the most exciting. I mean, sure, we'd love for it to solve, breast cancer or something like that as well, right? But that all of that innovation could benefit the rare disease community. It seems like at scale, which is what they really want in a business, right?
Totally.
I mean, that's interesting that that was, and just even under probably, think about how would this have gone down 30 years ago before genomics, right? Before this, I mean, 15 years ago, right? When did the full genome sequence happen? They would have just said, I don't know what's wrong with your son. So at least now, oh, okay, there's a genetic mutation or something that's causing it, right? At least that gives you some hope. Is that
100%? Absolutely. I mean, the public awareness on realizing the medical footprint of rare disease is so important. But yeah, the science is so cool and it's rapid, right? Before, all of these kids would have been diagnosed with cerebral palsy. Throw it in the bag. CP still happening today, actually. But now with the affordability and the accessibility of genome sequencing, whole exome sequencing tests, and it just becoming easier in general, my hope is that so many people will go and get tested for it, even as an older person, as a teen, and not just getting that one chance when they were a kid and when they fought for it, but to get all of those patients that are out there. Do you know how many other CT and NB1 kids there probably are across the world? Probably thousands. And they are walking around with a cerebral palsy diagnosis. Like, we need that patient data. We need those people in our community. We need those in our natural history study, because when we can get all of our patients together and get the data all together, that's when we can get bigger things to pay attention, like the researchers and the pharmaceutical companies.
Yeah. Just gave me chills thinking about it, like bringing them together. I mean, I think that's one of the things I love most about technology. I mean, at the end of the day, I love the way technology transforms things. And this is a great example of how technology could transform the approach to so many illnesses. It's very cool.
Yeah, I feel like in rare disease, in normal land, you hear about like, protect your data, protect it, secret, safe.
Yeah.
I do not care. I think in rare disease, we should share it. We should sell it. We should hand it out, because I want doctors and researchers and scientists to come in and open the CT and NB1 door. I want them to look at our gene. I want them to be intrigued. I want them to hear our stories from the podcast and hear about what really matters to us day to day and what our kids are living with. I want them to know everything. I want them to be able to be like, you know what? I think I'm kind of interested in whatever beta-catenin does. I think I'm going to go look at that. And if they can use these platforms like Allstripes, like the Matrix, like Citizen, and just go in there and be like, oh, CT and NB1, what a great 300 population. That's a robust enough one for me to start lifting off from and doing some research on or paying attention to, because all of it's there. Everything's organized. You can look at all of the de-identified information of all of our kids, and you can do something about it. But if we're all scattered around and nobody has the right diagnosis and everybody is locking up their information, where are we going to go? Where are we going to get? We're not going to get anywhere.
Yeah. It's amazing how privacy doesn't matter when you're going to die.
Yeah.
Or when you're suffering through a debilitating disease, right? Like, privacy is such an afterthought. I remember there's a great story of a guy in Italy who literally published his whole data online because he knew he had a rare condition. And he said, what do I have to lose? Right? Like, and so he's like, I'm going to put it all out there. I'm including full CT scans and MRIs and stuff to say, hey, let's crowdsource this, right? And try to solve the
Yes.
problem.
Yes, I love that, especially when it's a parent who has a kiddo who has a degenerative disease, where time is of the essence. My friend Mike calls it time is brain. The sense of
Yeah.
urgency that needs to happen is it's unfathomable. And with things like technology that can kind of bring all of this data together and make it open for the right people to come in and take what they need and look at populations and gather scientific information to help create trees and treatments and cures. I mean, like, as I know most parents like me are like, here it is. Here's all of our stuff. It's organized for you. We did it. We did all the work for you.
Yeah. So you've given some good insights. I mean, one, show some empathy for these patients that, are diagnosed with a rare disease. I think that was a great piece of feedback. And then of course what we just talked about, right? And, get access to the data, share the data, look at the data and diagnose appropriately and use what's available. Are there any other things that, health IT companies, because obviously our community is a bunch of health IT professionals, what could they do to better serve you? And maybe not even specifically to the diagnosis and the rare disease, but even, as you said, your son's a professional patient and you're a caregiver of a professional patient. What could these organizations do? Like what's your top 5 list of things that just annoy the heck out of you?
Uh, Silos annoy me, number one. People not collaborating, patient population advocacy groups arguing and then going off and making their own instead of working together. Reinventing the wheel when other families have already done that work. They'll share their homework with you. They will tell you the mistakes they made. They will tell you the companies they worked with that failed them. They will help you not do it over again and waste time, because time is so precious. So I think when egos get involved in advocacy groups, it's devastating to our patient population and to science in general. So I want to see those silos just get taken out by a tornado. And I want collaboration to be key. I want data sharing to be key. Data is power.
Yeah.
I want privacy. Privacy is overrated, in my opinion, for what we're dealing with our kids. I just want everyone to share this information with each other, share their homework, so we can all move forward together. When one disease gets a treatment or a cure or passes a milestone, we're all so excited. That's a win for us, even if it's Angelman's who just did this amazing thing, and SMA who got a cure. Like, that is a win for us. We have to do what they did. We have to copy them. They've already done so much of the work. We have to go there. So I really think, like, letting your ego go, that's such a long-winded answer, sorry. I feel like just in the setting, the beginning, like you said, the communication between the healthcare practitioners and the patients, it's obvious it's a little broken and it's sometimes insensitive, and they aren't coming to the appointment with all the information because they haven't looked or they just don't know. But really figuring out kind of a guidepost to be able to give families when they're diagnosed. And maybe it is something silly and simple like a podcast, John. I mean, the amount of resources on my podcast is mind-blowing. Like, if I had that when Ford was diagnosed, man, I'd be miles ahead. Simple things like that, guiding families in the beginning carefully and with care, figuring out ways for my son's doctors and everyone to communicate. Like, I wish there was some sort of electronic system that they could all know about my son. We have to do all the legwork. I have to make sure every doctor knows everything about the other doctor. It's such a mess, and most people can't do it or give up. I wish there was, I don't know what kind of platform that is electronically to be made, but the medical records for my son should be open to anyone who's seeing him.
Mhm.
That would make such a huge difference in our entire well-being as a family and as a community if the communication and the continuity of care was not broken. How many did I give you? 1, 2, 3, 4.
That was it.
I mean, I have so many.
No, it's great. I'm surprised you didn't say, help me with this stack of bills that is all confusing as I'll get out from 15 different places. I can only imagine.
Oh, it's impossible. It's impossible. And even our things that are offered state to state with, like in Washington, they call it developmental disabilities association. Garbage. Ford's 5 and I still can't get him on it. I've even been told that he didn't qualify for the first 4 years because I have no idea. It doesn't make sense. Right. And the hoops that you have to jump through to get any sort of help financially or all of the things you just mentioned, forget about it. If you don't have the time, a college degree, access, like it's crazy. It's crazy.
Well, and just think about and we've talked about this a number of times in a lot of my interviews, is that there is this information disconnect when a diagnosis has come. And this is true whether it's rare or not, but I think it's more profound when it's rare, that the doctor has this amount of information about what's needed and what's going to happen and what's, what to expect and how this is going to go. And the patient or the caregiver of that patient has so much less, right? And like, how do we use technology? Do we point them to a bunch of Once Upon a Gene podcasts to say,
yes,
here's like 15 things that you may want to think about, right? And, I think in many cases we look at it and we say, oh, this information may scare them. But I think the lack of information is just as scary as the information that says, hey, this is the road you're about to go on, and here's someone who's been there. I think that's more powerful than, our imaginations, imagining what 1,000 things I'm going to have to deal with and what it means, and is there any hope? And so,
yeah, we really need to find innovative ways to include technology to help shorten the diagnostic odyssey and to connect families with, I don't know, smart like AI data sharing of our medical records to point people in the direction that is going to help them.
Yeah. But not even just medical record data sharing, right? I mean, you highlighted something that the healthcare organizations, I've seen a small efforts in this regard, but it's connecting communities of people who are dealing with the same challenges. And that is a very different thing than connecting the data, right? I think they're both important.
Yes, absolutely. I mean, I'm gonna go with the be with your people and find your people number one, definitely. And you don't have to be in your own disease group, like you said earlier. Like, we all identify so closely with each other, and it doesn't matter what diagnosis we all have, because our life is so similar. We're dealing with the same exact struggles, and you don't need to share symptoms and everything to find that connection. No.
Yeah. Well, Effie, you said something. You said time is precious, and I think that's true. And I guess I would just say thank you so much for taking time with us and your busy schedule with your son, with your podcast and everything. I think you gave us some great insights and perspectives into, something that I think a lot of us probably take for granted, and that we probably don't understand well enough. So thank you so much for taking time, and thanks everyone for listening. If you want to find all the rest of the podcasts in our interview series, you can check them out at healthcareittoday.com. Thanks, Effie.
Thanks so much for having me, John. It was so nice to talk to you, and thank you for what you do, and thank you for being curious and spreading this message.